So you want to get these feet in just good warm salt water, you know, get a good pan, put the feet in for about 7 to 10 minutes, about 3 times a day, because you're really trying to increase blood flow.
Okay, telling nurses.
It's going to be on an antibiotic.
Okay.
And that should settle down. Now what can happen, unfortunately, in the geriatric population is the soaking, the antibiotic, we can clear up the infection. But what can happen is they can get what we call neuropathy. They can get nerve damage from infection. Very common in the elderly. In which case, even light touch becomes pain.
Yeah.
Right. And because I'm not touching it, still very hard and it's painful.
Yeah, it is.
Right. And it gets to the point where the bed sheets, you know, like you can clear up the infection, but the pain is still there.
Okay.
And essentially, the redness will go. Skin will look pretty good.
But he'll still be sore.
Yeah, like you go.
And that's what he was like before. We couldn't see anything.
Yeah.
He would say it hurt, right?
Yeah, and that's neuropathy.
Okay.
Yeah, that's the essence of peripheral neuropathy. And it's actually a vascular thing. It's where there's just not quite enough blood flow getting to the extremities. Even though he's got pretty good warmth coming to his toes.
Yeah.
Yeah, they're still pretty warm.
Yeah, oh yeah.
Like, is it painful to touch here?
No, no.
No. So it's pretty isolated. It's not
just the
there.
big toe.
It's all just.
Yeah, right there. Oh yeah.
As soon as you get to that point, yeah, which is kind of where the infection is.
Yeah.
Yeah. So when you have neuropathy, it's misery.
It's misery.
Yeah.
Right.
It does help to, over time, to give the nerve something to do. Now, what does that mean? It means you can take any cream, oil, whatever, and just kind of massage the skin,
Yeah.
Now, as long as he's not screaming and hitting you with a cane or something,
You wouldn't do that.
Yeah. But you do that, especially at night before they go to bed or a couple times during the day, because you're trying to give the nerve something to do other than just fire pain all the time.
Right.
Right?
Yeah.
People get it with amputations, the stump when they're massaging their stump, get these neuropathic pains. Drugs don't work for that. It's just really trying to re-educate the nerve, keeping things away from it, obviously, that are going to irritate it.
Yes.
Yeah. And it's always worse at night.
Yes.
Yeah.
Seems like the joint is hard to turn,
That's a pretty good joint, actually. The amount of movement you got there.
Yeah.
For a 92-year-old joint.
Yeah.
Yeah. No, that's actually
He's
a good
pretty
joint.
amazing.
Yeah. So we got the long history of toenail fungus.